So when it comes to high blood pressure medication, you can ask your doctor to have your medication changed if one of the two following reasons have occurred. First, the medication is not effective. In other words, you've used it, but it's not bringing down your blood pressure. And second, if you have developed an adverse reaction to the blood pressure medication. Getting your blood pressure medication right has to be a two-way communication between you and your doctor. The sooner your doctor knows, the better. When you have been identified as having high blood pressure, I want to assure you that it's not the end of the world. In fact, it's an opportunity for you to go on and live a more fulfilled life. So all the bad habits that you have adopted, this gives you the opportunity to kind of review those habits, to stop smoking, to reduce the amount of alcohol consumption, to try and lose weight, to exercise. All these in themselves, while they would help you lower your blood pressure, would also help you feel better and more healthier as you make progress during this journey. It is rare for the first set of medication that is prescribed by your doctor to be optimal in terms of treating your blood pressure, and that is due to a number of reasons. So one of the reasons might be due to the fact that we have different physiologies and different genetic makeup, and as such the way we react to the high blood pressure medication might vary from one patient to another. So while one patient would respond positively to 5 milligrams of Lisinopril, another patient might not see any change in their blood pressure being lowered as a result of using the same dosage. So that might mean that the doctor would need to prescribe a higher dosage or a different medication altogether. So a family history of high blood pressure could actually determine whether a particular type of medication is effective in lowering your blood pressure. So for example, if your mom or dad has been prescribed Lisinopril in the past and they've had an adverse reaction or no improvement as a result of using that medication, it is likely that you would have the same response towards that medication too. Therefore, that information can be helpful when working with your doctor to kind of understand the type of medication that you're being prescribed. Another reason is that there might be some mitigating factors that has resulted in you having high blood pressure. So, for example, it could be that your having high blood pressure has been stress-induced. So, a way to lower your blood pressure in this instance might be trying to eliminate the source of stress altogether. And that might mean that medication might not be necessary, but eliminating the stress would be helpful. It also might be a situation where you have an underlying condition that has triggered you having high blood pressure. So what will be needed on this occasion will be trying to identify what that underlying condition is, and if the doctors are able to cure that underlying condition, then it means that your blood pressure would be able to or might be able to return to normal. And the final reason is just adverse reactions to the medications that are prescribed by your doctor to lower your blood pressure. So these could be the reasons why it is rare that your doctor gets your high blood pressure medications right on the first occasion. When you're prescribed your blood pressure medication, it's important that you continue to monitor your blood pressure. And if you see that it's not working, reach out to your doctor as soon as possible. Plus, it may be that you react adversely to the medication and therefore you need to reach out to your doctor as quickly as possible, so that that medication can either be changed or it can be used in combination with another type of medication. It may be that the medication prescribed to you results in a combination of adverse reactions, or maybe just the one adverse reaction, like being dizzy, suffering from nausea, experiencing swollen joints, etc. So any of these sensations as a result of using the medication needs to be fed back to your doctor, so that your doctor can actually work with you to ensure that you are on the optimal type of medication. But one thing that I would like to emphasize here is that it's important that if for any reason you need to stop your medication, you inform your doctor. Do not just stop your medication and look for an alternative solution, because it may be a situation where the doctor wants to use that medication to lower your blood pressure, and having seen some progress, he or she can take you off that medication and prescribe some changes in lifestyle that would help you to keep that blood pressure low. Also know that the fact that your doctor has prescribed a type of medication does not necessarily mean that you have to stick with it. As soon as you realize that the medication is not working for you, you need to reach out to your doctor, and this is really important. I cannot overemphasize the importance of this, because I have spoken to people who have been given high blood pressure medication, and because of the reaction they've had to it, they've just stopped without consulting their doctor. This is very dangerous, and it's not something that you want to do. Sometimes your doctor would combine different types of high blood pressure medication to see which one works best for you. So that may mean combining a calcium channel blocker with a beta blocker, or combining an alpha blocker with an ACE inhibitor. Your doctor would know what combination will be best for you, and if he or she has been working with high blood pressure patients for a considerable amount of time, they're quite experienced in terms of what will be best for the patient. There are guidelines out there that recommend multiple doses of medicines for high blood pressure. So this means that a patient might take 2 types of medication in one combination pill, or 2 separate pills altogether, while offering the benefits of both medication. Finally, the importance of you taking your blood pressure medication and lowering your blood pressure cannot be overemphasized. Remember, as you get your blood pressure down, you lower the risk of any potential cardiovascular disease or stroke, which is the place that you want to be. So if you have any questions for me regarding how to deal with your doctor, I'm not a medical doctor, but I have 10 years experience as a high blood pressure patient. And in the early stages of my dealing with high blood pressure, I had adverse reactions to some medication, which resulted in me working with my doctor to be able to come up with the optimal combination that works for me. So what works for me would not necessarily work for you. But if you have any questions that I can help you with to go back to your doctor, please drop me a comment, let me know. And if this video has been helpful to you, I would appreciate that you give it a thumbs up by smashing the like button, and subscribe so that you can receive future videos that will be released on this channel. Also, why not share this channel with friends and family, as you could also help save lives by doing this. So I hope to see you in the next video. Take care and look after yourself. Bye.